2 weeks ago, one of my patients, a young man, came to my clinic complaining of severe pain at the back of his jaw. He said that it was accompanied by swelling, difficulty opening his mouth fully, and even a bad taste in his mouth. He had been enduring it for weeks, assuming it would go away on its own. During the examination, I found that the pain could be due to several reasons. Perhaps the wisdom tooth was impacted. Maybe it was pressing on adjacent teeth, or it could even have caused an infection. These are just a few of the possibilities we'll discuss today, along with the best ways to deal with them. Hello, everyone. I am Dr. Noor, your dentist, and I am here to help you take care of your mouth. So, you may feel some of these symptoms or even more, and it can be mild or severe. If this sounds familiar, don't worry, you're not alone. Wisdom tooth problems are super common, and today we're diving into everything you need to know. We'll break down the causes of wisdom tooth pain, the symptoms to watch for, and how to handle them, whether you're managing it at home or heading to the dentist. Stick around, because some of these symptoms can feel really similar, and the right treatment isn't always what you'd expect. Wisdom tooth. Why does this happen? An impacted wisdom tooth happens when there's not enough room for it to grow in properly. Instead of coming in straight, it can stay stuck under the gum in all kinds of weird positions. Sideways, tilted forward, tilted backward, or, in rare cases, even upside down. What are the symptoms? Pain that comes and goes as the tooth tries to push through. Sometimes it's mild, other times it can really hurt. Swelling in the gums around the tooth, trouble moving your jaw, especially when you're eating or talking. Pressure or pain in nearby teeth if the wisdom tooth is pressing against them. The discomfort usually lasts for a few days at a time. Painkillers can help, but the issue might keep coming back until the tooth is fully removed or aligns naturally, which isn't very common. Now, how to treat it. If you have an impacted wisdom tooth, it usually needs to be removed surgically by a dental professional. The procedure can take 15 minutes to an hour, depending on how complicated the extraction is. Your dentist will likely take an X-ray to get a clear picture of the tooth's position. Based on that, they'll decide whether it's better to wait and monitor the tooth or remove it right away. Got it? Great. Let's move on to the next common issue. Over the wisdom tooth. What's going on? When a wisdom tooth only partially comes through the gum, it can leave a flap of gum tissue, called an operculum, hanging over part of the tooth. Unfortunately, this little flap is the perfect trap for food, debris, and bacteria, leading to gum inflammation. How does it feel? Pain around the wisdom tooth, ranging from mild to severe. Intense discomfort if the upper wisdom tooth presses on the inflamed gum flap. Chewing feels like a chore. It's tough with the gum so tender. If the inflammation gets worse, you might notice difficulty swallowing, throat pain, jaw discomfort, or even trouble opening your mouth. What can you do about it? At-home tips. Try rinsing with an antiseptic mouthwash that contains chlorhexidine to keep the area clean. Hydrogen peroxide works well too. Use it as a rinse to reduce bacteria. If there's a severe infection or gum abscess, antibiotics might be necessary. But don't take them without your dentist's recommendation. When you visit the dentist, first, your dentist will focus on calming down the inflammation by cleaning underneath the gum flap using antiseptic solutions. If there's a bacterial infection, they might prescribe antibiotics. In some cases, the dentist may remove the flap of gum tissue surgically or with a laser to prevent future issues. If the gum keeps growing back and causing problems, it might be time to remove the wisdom tooth entirely. So, if that gum flap over your wisdom tooth has been giving you trouble, don't wait. Start with at-home care and check in with your dentist for the next steps. Let's move on to another common wisdom tooth issue. Third, wisdom tooth pain. From a gum pocket, between it and the next tooth. What's happening? There's a tight pocket between your wisdom tooth and the tooth next to it, and food debris loves getting stuck there. Bacteria can easily thrive, especially since this area is tough to clean with a toothbrush or floss. It's way at the back of your mouth. Things can get even trickier if your wisdom tooth is tilted forward or growing sideways, making it even harder to clean and more likely to cause problems. How does it feel? The symptoms are similar to inflamed gums over a wisdom tooth, but there's a twist. Early on, the pain spikes when food gets trapped between the teeth, especially during meals. The pain tends to fade noticeably once you've managed to get rid of the food stuck in there. What can you do about it? At-home tips. Stay on top of cleaning this tricky area with your toothbrush, and, especially, floss. If regular flossing is a struggle, switch to a water flosser. It's a game changer for cleaning those hard-to-reach spots. I'll drop a link in the video description so you can check one out. When you visit the dentist. First, the dentist will address the inflammation by using antiseptic rinses, like chlorhexidine or hydrogen peroxide. They might also give you a chlorhexidine-based gel to apply at home for added care. Whether or not the tooth needs to be removed depends on its position. If the tooth isn't impacted and looks healthy, the dentist will probably just show you how to clean the area better to avoid future problems. Tooth decay. What's going on? Wisdom teeth sit so far back that they're hard to reach with a toothbrush, even when they're fully erupted. This makes them extra vulnerable to decay. How does it feel? It depends on whether the decay has hit the tooth's nerve. If the decay has reached the nerve, intense, unbearable pain. A classic sign is waking up at night because the pain gets worse when you lie down. Drinking anything hot or cold feels like torture, and the pain often feels like a rhythmic, throbbing heartbeat. Remember, if the tooth next to your wisdom tooth is decayed, it can cause similar symptoms. So take your time before deciding which one is the cause. If the decay hasn't reached the nerve yet, you'll notice pain when eating sweets or drinking something cold. The pain is mild compared to full-on nerve inflammation. What can you do about it? At home. Tips. If the pain is intense, take an over-the-counter painkiller. If that doesn't cut it, a pharmacist might recommend an injectable painkiller. Just be sure to mention any other health issues you have. To calm the nerve, try clove powder or clove oil. Both contain eugenol, which is great for soothing nerve inflammation. When you visit the dentist, get to your dentist as soon as possible. If the nerve is affected, they might suggest a root canal, extraction, or temporary treatment until you can proceed with the next step. If the cavity hasn't reached the nerve yet, a simple filling can save the tooth. With the right treatment, you'll be back to feeling great in no time. Let's keep going to cover more wisdom tooth issues. 5. Nerve pain in the tooth. Next to your wisdom tooth. What's the cause? Sometimes a wisdom tooth grows at an angle and pushes against the roots of the tooth next to it, the second molar. This can lead to damage to the second molar, including erosion or decay, food and bacteria getting trapped between the two teeth, which can make the problem worse. If the second molar's nerve becomes affected, it can cause symptoms similar to the intense nerve pain we discussed earlier. The tricky part? The second molar might look perfectly fine from the outside. You'll only know for sure with an X-ray, which can show if the wisdom tooth is pressing into the second molar. How do you fix it? If the second molar is decayed, your dentist will either fill it or perform a root canal to treat the nerve. The wisdom tooth will need to be removed to prevent further damage. If the second molar is too damaged to save, it might need to be extracted instead. Then, you'll decide with your dentist. Should you replace it with a dental implant? You'll also need the wisdom tooth removed. Or use braces to shift the wisdom tooth into the second molar spot. Tooth pain while it's erupting. Why does it happen? When your wisdom tooth is breaking through the gum, it's normal to feel some discomfort, even if the tooth is in the correct position. The pain comes from the pressure the tooth puts on the gum as it pushes through. What can you do? The pain is usually mild and temporary. Over-the-counter pain relievers like Panadol are usually enough to manage it for a few days. If the pain comes back later, it might be due to one of the other issues we've already talked about, so don't ignore it. Before wrapping this up, you will find a link to an article down in the description below. Now, let's wrap it up. No matter the reason for your wisdom tooth pain, here's how you can manage it in the meantime. Take over-the-counter painkillers, or in severe cases, consider an injectable pain reliever. But consult a professional first. Rinse with an antiseptic mouthwash like hydrogen peroxide or chlorhexidine. Use antibiotics only if prescribed by your dentist. Keep your mouth clean with regular brushing, flossing, and clove oil for nerve-related pain. These tips can help you feel better until your dentist can get to the root of the problem. One last tip. Never self-prescribe antibiotics or other medications. Always let your dentist guide you. Seriously, this is super important. Stay safe and keep smiling.